Harper Wave and HarperAudio present The Self-Healing Mind, an essential 5-step practice for overcoming anxiety and depression and revitalizing your life. By Gregory Scott Brown, MD. Read by the author. This book contains advice and information relating to healthcare. It should be used to supplement rather than replace the advice of your doctor or another trained health professional. If you know or suspect you have a health problem, it is recommended that you seek your physician's advice before embarking on any medical program or treatment. All efforts have been made to assure the accuracy of the information contained in this book as of the date of publication. This publisher and the author disclaim liability for any medical outcomes that may occur as a result of applying the methods suggested in this book. For Patsy, Trevor, and Trem-Ann. Introduction. In early spring of 2020, a longtime patient reached out to shake my hand as our therapy session came to a close. Almost immediately, he realized his blunder. "How long do you think we'll be doing this?" he laughed as he bumped his elbow against mine. I could only shrug and reply. At the time, the United States was just beginning to see the rise of COVID-19 cases, but I had no idea the coronavirus pandemic was about to ripple across the world like an earthquake, changing the entire healthcare landscape, including mental health delivery as we once knew it. I also could not have predicted that, because of infection control mandates, I'd have to close my office to in-person visits a few weeks later. Life was changing, and quickly. I began to see my patients virtually, doing what I could to connect with them through tablets and screens. I also had to put many of my favorite wellness practices on hold, including my regular visits to the yoga studio, and more carefully consider how to encourage my patients to continue their own self-care regimens. As the novel coronavirus continued to spread across the country, I, like many other mental health professionals, noticed an uptick in requests for new appointments. There were many reasons for that. Some people felt increasingly isolated by stay-at-home orders and social distancing guidelines. Others were having trouble adjusting to working from home or struggling to manage their kids as they attended online school. Some were just worried about the virus and its potential long-term impact on their families or businesses. People were coping as they could, yet for far too many, the situation lent itself to increased anxiety and negative thinking. In some cases, I also saw substance misuse relapses as people turned to alcohol or drugs to help manage their stress. COVID-19 was far from the only problem haunting the country. In the wake of George Floyd's and Breonna Taylor's murders by police, xenophobia against Asian Americans, and a chaotic news cycle, images of brutality and overt civil unrest were delivered into our homes each day. Not only were we getting a daily dose of the thousands of people dying from this new and insidious virus, but we were also watching the cumulative physical and emotional trauma of millions of Americans of color being played out on our smartphones and television sets. The combination took a heavy toll on all of us, and soon mental health was on everyone's mind. We thought about it more, even if we weren't always talking about it. Although this book was years in the making, the turbulent events of 2020 led me to reassess the state of my own mental health, while simultaneously treating patients in my outpatient practice. It became even more vital that I record my thoughts about the importance of self-care and mental health maintenance on paper. My work offers me the opportunity to hear so many stories, treating patients in my office, as well as hosting conversations about mental health with athletes, musicians, actors, and journalists in an effort to help reduce mental health stigma. Many of these discussions involve people who have grappled with depression or sleep difficulties, or have experienced a rocky relationship at home. Some people just need someone to talk to, a neutral sounding board, someone with whom they can safely blow off steam as they work through their thoughts and feelings. Practicing psychiatry is humbling, even in the best of circumstances. No psychiatrist is omniscient, and as the mind is such a perplexing entity, we need to be open to different ways of thinking as well as different ways of addressing.
Sample complete. Ready to continue?